In terms of local government involvement in family planning programs, I would say Pathfinder has been the forerunner, like forefront in promoting local government involvement in family planning programs. Like, there are 3 tiers of government in Nigeria. You have the federal, you have the state, and you have the local government. The federal formulate policies. They support tertiary institutions, the state secondary institutions. The local government is where all these institutions are based. Local government is where services are provided. So what Pathfinder recognized this several years ago when USAID gave a grant of $100 million with the government of Nigeria to provide family planning program. And what we did, Pathfinder did then, was to recognize the role of local government. We had local government action plans in all the states of the Federation. We developed action plans that showed what the local government contribution will be, what Pathfinder contribution will be, and what the federal government contribution will be. We identified local government leadership, the political leaders and the technical leaders. So we had the local government chairman and the secretary, and we had the local government primary healthcare directors, all brought in for a 1-week planning program. And so we established a program at the local government level. The policymaker came at the beginning and at the end to approve those plans. And so right from that time, we've been involving local government, because if you don't involve them, you will not get the information out. You will not get the support. You will not get the enabling environment. So Pathfinder recognized that early enough, and we have been doing that. I can tell you it's a big challenge, but the first challenge is the fact that you have no control over what they do and how they do them. You cannot direct them. You cannot tell them to work the way we work. So that's number one major challenge. But the major issue is they have budgets that are released at the beginning of the year. For instance, they'll say we have 50 million for reproductive health this year. At the end of the year, not 1 million has been released, but it's on the pages of newspapers. So we try to work with them to see how they can actually put money. So when we design program, for instance, we will say, okay, your contribution, we will not give you this unless you're able to, if we contribute 1 million, you should be able to contribute 10% of that or 20% of that. So with that, we were able to get them to at least increase their commitment. The other thing was, some of them, because of religious belief, traditional beliefs, they bring them into governance. And so what we did was also to ensure that we take them to other countries where there have been success stories. So they see how religion and how culture is supporting family planning programs. And that has been found to be very, very successful. The other big challenge is the fact that they see you as competitors. Because once, as an international organization that is non-profit, we are more flexible, we are more innovative, we can change things, but the government system is kind of rigid. There's one way of doing business. There are what they call civil service rules that guide them, and they don't bend them. Until those rules are changed, you cannot bend them. So we dealt with that, and so that's one other problem. But the biggest challenge we found is that you train people. We keep training and training and training, and other groups are coming in to also train. UNICEF comes to train, UNFPA comes to train, UNDP comes to train, WHO comes to train. We're training the same person. Coordination has been a big challenge, and I think we're dealing with that right now. One policy I will point a finger to will be the population policy. The population policy said 4 women, for instance, I'm just giving one aspect of it. 4 children per woman, not per couple. It's per woman, not per family. What I meant, okay, it's okay you say 4 children, not more than 4 children per woman. But Nigeria is not, it's a society where you have a lot of polygamies. Nigeria is a country where you have people who are Christians, you have Muslims. Muslims believe, the general belief in Nigeria is that as a Muslim you can marry up to 4 wives. So if you say 4 children per woman, that means for that one man, he can have up to 16 children. The Christian person can only have up to 4 kids because religion says 1 man, 1 wife. Okay, for the woman it's okay, it's good for the woman's health, but for the population itself it's not very good because you discover that there is this politics of numbers where the revenue allocation in the country is dependent on the population. And so you find people saying, well, if there are 15 men in X state, and X state is predominantly Muslim, that means 15 men times 16 children would give you an estimated population. If there are the same 16 men in Y state, and Y state is a Christian state, that means those 16 men will have only 16 times 4. So you discover that population of numbers, and that because of that, you find people who would have planned just say, no, if it's not going to work for me, if he can have 16 children, I'm only allowed to have 2. So in that way, it became negative on the population policy, you know, because it was supposed to cut down the number of kids that you have, but it was good for the woman. But for the man was allowed to have many more. He could have up to 20, he could have up to 60. Nobody cared. So that was one place where I think the policy was really, really faulty. We should have looked at the family, say per family size, you're only allowed 4. So if you choose to have 4 wives, that means you're allowed to have one kid per woman. We should have been more strict, but we were not.